chapter is on both the axial and appendicular muscles. So it's really chapter 11 and chapter 12. When we refer to the axial muscles, we have to first remember that they are going to be attached to the axial skeleton, and there currently are superior and inferior attachment for most axial muscles. And then for appendicular muscles, there are proximal and distal attachments. The functions of axial muscles are going to include functions that would help to support the head, the vertebral column, and the thoracic cage. They're muscles that are used in facial expression, chewing, and swallowing. They aid in breathing, so muscles like the diaphragm muscle. They also support and protect the abdominal and pelvic organs. So this slide is showing us some selected axial and appendicular muscles from the anterior view. So I want to go through and just highlight some of them for you. I'd like you to notice that on the left-hand side of the diagram are going to be more superficial muscles. On the right-hand side of the diagram are going to be deeper muscles. So in the facial region, we have a large muscle called the occipitofrontalis. And it's called this because it's the combination of the frontal belly as well as the occipital belly, which is on the posterior surface of the skull. There's the orbicularis oculi muscle, zygomaticus major, orbicularis oris, and platysma. And some of these selective muscles that you'll need to know, we'll be going through them individually. And what's important for you to know is the functions, not so much where they're attached to on the skeleton. The deeper muscles in the skull would be temporalis and masseter muscles. In the shoulder area, for superficial muscles, we can see the front of the trapezius muscle, deltoid, pectoralis major, triceps brachii, biceps brachii, brachialis, external oblique, pronator teres, brachioradialis, flexor carpi radialis, palmaris longus. And the deeper muscles would include the sternocleidomastoid muscle, sternohyoid, pectoralis minor, serratus anterior. Breathing muscles would include the external intercostals and internal intercostals. In the abdominal region, we have the rectus abdominis, transversus abdominis, and views of the internal and external obliques. In the lower part of the body, on the superficial side, we see the tensor fascia latae, adductor longus, sartorius, which is the longest muscle in the body, the gracilis, the quadriceps femoris group. And it's called this because it's actually made up of four different muscles called the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. A way to quickly remember this group is Rex and his three vastus sisters. So a lot of times when you learn the names for some of the muscles, there are little memory tricks that can help you. Continuing to the lower leg, we see the fibularis longus, tibialis anterior, external digitorum longus. And the deeper muscles would be muscles like the iliopsoas, pectineus, and extensor hallucis longus. And for individual functions, we're going to go into those specifically in upcoming slides. For the posterior view, we see the rest of the occipitofrontalis muscle, which is the occipital belly. The belly is where the majority of the fascicles are located at. The sternocleidomastoid, trapezius, which is mostly on the posterior view, the deltoid muscle, teres minor, teres major, triceps brachii, latissimus dorsi, In the arm region is the extensor digitorum, extensor carpi ulnaris. For deep muscles, we see the semispinalis capitis, splenius capitis, levator scapulae, supraspinatus, rhomboid minor, rhomboid major, infraspinatus, teres major, serratus anterior, serratus posterior, external oblique, internal oblique, and erector spinae muscle. Some of these you won't have to know. For example, you're not going to have to know the erector spinae or the semispinalis capitis. So again, the slides which are upcoming will further delineate exactly which muscle functions you need to know, names and functions. In the gluteal region, we have the gluteus medius, gluteus maximus, gluteus minimus, piriformis, and quadratus femoris, which is different than the quadriceps group. This is quadratus, not quadriceps. There's the adductor magnus. So there's actually three groups of muscles in the adductor group. There's the adductor magnus, adductor brevis, and adductor longus. In the lower limb, we see the hamstrings, and you should know the three muscles found in the hamstrings group would be a biceps muscle called the biceps femoris, semitendinosus, and semimembranosus. There's also another muscle called the gracilis and the iliotibial tract, which oftentimes is simply abbreviated as IT band or IT tract. We then have the gastrocnemius muscle, which is in the calf area. We use this muscle when we want to stand on our tiptoes or when we want to step on the gas. There's the calcaneal tendon, also called the Achilles tendon. And deep to the gastrocnemius would be the soleus muscle. So that's just a little introduction of some of the muscles to know. And in the subsequent videos, we're going to go over the specific region, and I'll point out the main functions of some of the specific muscles that you should know.